Another really common question I get from patients is how do I prevent genetic cancer? Preventing genetic cancer has several facets that are definitely worth exploring. So first, does the patient contain one or two copies of the gene or the precancerous gene? So for many cancers, it requires a complete and full mutation of both copies of a gene to manifest in disease. Another important concept to keep in mind is that the greatest risk factor for cancer is time. Okay? I'm going to say that again. The greatest risk factor for cancer is time. Everyone contains cells that spontaneously develop small precancerous mutations. A healthy immune system normally detects these risky cells and destroys them before they develop into uncontrollable cancerous lesions. Unfortunately, as we age, sometimes these precancerous changes go undetected for long enough that they do develop into cancer. The most important factor in preventing genetic cancer is to keep yourself in good health, which includes eating a nutritious diet, exercising, getting regular physician checkups, and supporting positive mental health practices. There is no cancer that is caused by any one single event or thing. Cancer ultimately develops from small, incremental damages and changes to cellular DNA that cascade over time, unless you're exposed to, something terrible like Agent Orange or radiation. Now, if we know a patient contains a well-studied genetic mutation, this indicates that they have an increased risk of developing the associated cancer. But healthcare providers and geneticists cannot say with 100% certainty that a particular patient will develop cancer. So, for example, going back to the BRCA1 and BRCA2 genes for breast cancer, those genetic mutations account for a majority of hereditary breast and ovarian cancer. Carrying two copies of the gene, however, does not 100% guarantee that you will develop cancer. Extensive meta-analysis studies have been shown that taking oral birth control and smoking increase your risk of breast cancer, while breastfeeding, having a child later in life, and having a late age at menarche, which is when you actually start menstruating. So starting menstruating later in life are all protective against developing breast cancer. Some women opt to have risk-reducing surgery, so they have a radical bilateral mastectomies. Having this surgery, though, does not completely eliminate the risk of developing cancer elsewhere, and I think special consideration should be given to the risks of surgery, right? So infection, allergic reactions to the medications, disfigurement, the psychological issues from body image issues. Other patients preemptively have both ovaries removed, called an oophorectomy. Keep in mind, though, this increases her risk of developing heart and bone disease because to take your ovaries out results in early menopause. So there's always this question of risk versus benefit, right? Every decision in this equation, carries a risk versus benefit algorithm that must be extensively discussed and meditated upon. We do not currently live in a Star Trek time yet where we have a cure for every kind of cancer, but there are surgical measures that you can take to kind of prevent cancer. But those decisions do come with a price.